Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to you.
It is 14 minutes after 6 o'clock on this beautiful Monday. It's still taking a little longer for the sun to peek out, but you know it's coming, it's getting there. So you can continue to do what you do and wake up with us, and we so appreciate your company. We're going to start today by talking with our dermatologist, Dr. Andrew Ford, and today we're talking about something called hand, foot, and mouth disease. And here, as broadcasters, we try not to get that, right, Belle? We try not to be affected by that. But Dr. Ford, first of all, how was your holiday?
Yeah, it was great. Yeah, it went kind of quickly this time.
It did.
Guess as you get older, everything goes faster, right?
Like that.
Yeah,
like
yeah.
that. We were anticipating, and then the day came and it went in a whoosh.
Where
Too
does it all
fast.
go?
Yeah. Do you have a family tradition, a family holiday tradition?
Well, we usually have something to eat. That's the big tradition, eating as much as we can that day.
That's normal, though.
Yeah,
Doc.
yeah.
That's normal.
Everyone's
So
like
you
that.
keep it very quiet and simple.
Mhm.
Okay. All right. Well, did you do any regifting, or do you have plans to do any regifting?
Regifting? Yeah, I still got some gifts at home to give out. Emergency gifts included.
Oh, do you do that? I know people
Yeah.
who do that. You buy generic things,
Uh-huh.
and then you just kind of wrap them and put them under the tree in case unexpectedly somebody stops by.
Really?
And they're like, hi, blah, blah, blah." Yes.
Yeah, I had this
you
one
put
for you.
generic things
That's
under
a
the tree.
good idea.
Yeah.
I have never done that.
Yeah, sometimes they can last from one year to the next.
Okay.
That's right.
Or you could always use that gift during the year if you have
birthday
another
or
emergency.
something.
Yeah, definitely, definitely.
Okay,
Good
now that
man.
we've gotten all that banter out of the way, we are happy to see you. And of course, we're wishing you all the best for the year ahead. But we appreciate your spending this final Monday with us in this year. So, hand, foot, and mouth diseases. Start by exactly what is this?
Well, hand, foot, and mouth disease is a viral infection which affects lots of children. Predominantly affects, as the name suggests, the hands, the feet, and the mouth. It is particularly contagious, and it has some pretty significant and clinical signs that we use to diagnose the condition.
What are some of those signs?
Well, some of those signs we'll see in our pictures. Usually what happens is that you get some red macules in the areas of the hands, the feet,
What are
or the mouth.
macules?
Macules are very flat,
Don't
small.
forget Miss
Oh yeah, we
Joseph,
did
Doug's
that.
friend
Yeah,
down in, you
that's
know.
true, that's true. Macules are very tiny, less than 5 millimeter flat areas, but they then develop into these tiny
looks like a
blisters.
wart, actually.
Yeah, tiny blisters with a red halo around it, and that can affect the hands and the feet and the mouth as well. So as we go through some of the photos, we'll see similar changes there.
Right. How similar is this to what we see in animals?
Well, it's a
Foot and mouth
different.
disease.
That's a foot and mouth disease. That's a different condition, different virus completely. A child here with many of the red blisters on the hands as well here.
Okay.
And it cannot be passed from animal to human. Right.
No,
I want
it's
to establish that because people may
it's
think it's the
passed
same
on
thing.
from human to human. Also, it can be passed from a pregnant mother to the child.
Why does it happen?
Right, this is a virus. These viruses called enteroviruses cause the condition, and there are a few that are very common. Oh, here you see the mouth. That you usually get about 10 or less of them in the mouth. They go through the same process of being a red flat spot, then being a blister, but eventually that blister comes off, and then you get what's called a little ulcer or an erosion. So, right. So these viruses, the enteroviruses, the Coxsackie A16, A6, and also enterovirus 71 are some of the most common ones, but just
But no, so you're
there's some of
smiling
the common ones
because you're just
'cause-
using the clinical
yes, these
names
are
of the
these
viruses.
are the names of the viruses.
Right.
So these viruses cause viral infections and illnesses. But actually what happens is that you get a sore throat, you may get a little bit of a fever, and you feel unwell just like you would with any flu-like illness. Sometimes it can be a little bit of diarrhea, and then you start to get the rashes. Now the rash in the mouth, which is called an enanthem, starts first usually, and then what you see on the skin, which is called an exanthem, starts after. But sometimes they can start together, and you aren't very unwell except for if you have a fever.
That looks like the
and that happens.
chikungunya rash, actually.
Yeah, this just goes to show that it can affect the arms in children. You get the little bumps as well, and then they become little blisters, and they can become erosions as well.
Does it cause any discomfort at all?
Yes,
What
well,
level of-
the mouth can be sore if you have it in the mouth. So that for a very young child under 5, that may make the child kind of fussy and they wouldn't want to eat and drink as they would normally. So that's the big thing, trying to control that.
Is there anything that they shouldn't be eating while these sores may be in the mouth, though?
No, the important thing is comfort and having a good diet while it's happening.
How prevalent is this in Barbados?
Well, you do have some pockets of infection. Because it's contagious, you can have bouts of it in schools, or sometimes a whole family can come in that would have the hand, foot, and mouth disease. But it isn't something you see all the time, but when it starts, it spreads for a while and then it stops. Because the incubation period is only like 3 to 5 days, so once you get exposed to it, it may take you 3 to 5 days to show signs.
Okay, wow. All right, so is that it for the slides?
No, I
Let's
just,
see some
you can
more.
barely see some tiny macules on
Yeah,
the bottom of the
especially
feet.
the
Very
right foot.
difficult to see, but that's just showing when it's early. And also there's one from the internet that I have for you, showing someone with both the hands and the feet, so you can get a picture of it. So it's very characteristic. Even the layman can diagnose it once you get these red things on the hands and the feet, and maybe a little soreness in the mouth, and they have bits of fluid in them, and then it usually goes away within about 10 days or so.
Right.
So it's a self-limiting condition that can go away without any treatment. All you have to do is to treat the symptoms.
Now, this mostly affects children who are 5 years old and under.
Yes, well,
But you
yeah.
can still get it as an adult.
Yes, adults can have it, but predominantly it affects young children.
What about race? Is it
No, it doesn't discriminate against race
Okay.
or sex. The distribution is equal in
okay?
all.
Does it manifest differently in the different skin colors?
No, it doesn't. The only thing you have to look at is if you are unfortunate enough to have a complication from it, because any viral illness can cause complications. It depends on when the virus is in the blood, if it decides to attack one of the organ systems. So if it attacks the lungs, or if it attacks the spine, or if it attacks the heart, then you can get infections in these organs, and that would be a serious complication, but very uncommon.
What about pre-existing skin conditions like vitiligo? We've talked about things like that. Does it complicate?
No, it doesn't. It doesn't complicate or affect any of those things. This is a viral illness on its own, and luckily it's very short-lived and usually very mild. So people can have it, enjoy looking at their pictures if they take pictures of it, and it's gone in less than 2 weeks.
All right, we should
All
take a
right.
break, and then we'll talk about treatment and management and that kind of thing.
Okay.
All right, we'll be right back.
Morning Barbados, good morning. Wake up, wake up, wake up. Morning to you.
We're back with you on Morning Barbados, and we are talking with our dermatologist, Dr. Andrew Ford. Sometimes we know him as David, but he's here, he's here
Andrew
with
today.
us. It's Andrew today. Good to have you here, and we're discussing hand, foot, and mouth disease. So treatment was one of the things that people would probably want to know. Do we look at a treatment or management?
Yeah, well, the management is multifold, but one of the things is trying not to let it spread, because it's contagious and it's
From
spread.
person to person.
Yes,
Yeah.
because it's spread from the droplets that come out of your nose or from out of your mouth, and also even from fecal contamination. So your hygiene is very important. So you have to be careful if you happen to be coughing or sneezing or anything like that. You have to be aware that it can other people can get it. So that's something you have to be aware of. Also, the liquid in the blisters can cause infections. So that's the important thing. But management-wise, the main symptom is pain in the mouth, and especially for the younger folks. So you can have some simple paracetamol to take care of that, or there are many topical pain-killing things you can put on the mouth, gels and that sort of thing, and also swishing little bits of painkillers diluted in water and that sort of thing can help. Other than that, the rash itself isn't very symptomatic. You may get a little itching. You don't usually have to use creams on it, but you can use some steroid creams if you want them to go away a little faster. But in 10 days or so, it's gone.
Okay.
What's important is that if a mother gets the infection in the first trimester, it can have some significant effects. So that can cause delayed growth in the child, or also it can cause spontaneous abortions. So the reason why you have to be careful with trying not to spread it is that if you're around any pregnant individuals in your society, then you should think about them and be careful.
Could this lead to meningitis?
Possibly it could. That's one of the unusual complications. If the virus goes to the brain, you can get meningoencephalitis. So it means it affects the covering of the brain and the brain itself. So that can have some significant effects. Also, if it affects the spine, then you can be unlucky enough to have some loss of motor function of the limbs. So these are the uncommon but severe side effects that can occur.
Okay. Well, this is there anything that we can do in terms of cleanliness? Does hygiene impact on anything?
Yeah, hygiene impacts on almost everything. Every contagious disease is affected by hygiene. So that's why it's important to wash your hands when you go to the bathroom, after going to the bathroom, if you're dealing with food. Also, if you know that you have symptoms like coughing or sneezing or any of those things, are you wiping your hands, picking your nose? All these are reasons why you should work on your hygiene. And you don't always have to have water now. There are all of these simple alcohol-based cleansers that you can use. So there's no excuse for not having good hygiene in a developed country like ours.
Correct. You mentioned adults also are affected by it. So what about when they have them in the mouth? How does mouthwash affect that? Or is there a type of mouthwash you should use?
Well, mouthwashes can sting if you have an abrasion or any sore in the mouth. I think we all know that. So we have to
So it's just
consider.
stinging.
Yeah,
That's
we have
it.
to consider
Okay.
not using them then.
Yeah, and we should let people know we are talking about
Hand, foot, and
pain
mouth
management and getting comfortable. Yes, we're talking about hand, foot, and mouth disease, and there is no cure. So it really is just managing it and writing
Yes,
out
because
that
it will
2-week period.
go away in a short time for the majority of people. As I said, only if you're really unlucky would that happen. And the lungs is another area. When people have complications, usually it's the lungs and the tissues in between the parts of the lungs that hold the air. The interstitial areas are the ones that usually get the problem.
So it recurs once you
It
have...
can. There are some reports of individuals getting it 3 times without having any immunocompromise. So you can be unfortunate enough to have it even though your immune system does recognize it and can produce antibodies to it. It seems like the cells in the body that help to fight things are more important than the antibodies themselves. So there are some people that can get it more than once.
In
But at
terms
least
of-
if you've had it before and you see
Right.
it again, you know exactly what
what
it
it is.
Yeah.
In terms of management, because, and if it's affecting children 5 years and younger, so I would think it's easier to pass on to the adults because it's the little ones who are
Yes.
not as conscious as, cover your hand and mouth when you're coughing and sneezing, and, mom is probably
Yeah.
going to be cleaning them when they go to the bathroom, those kinds of things. Do you need to go as far as keeping that child away from other children and perhaps managing like the bed sheets and stuff like that? Do you see what I mean?
You have to be careful, but you don't have to go overboard with it. You don't have to be quarantined or anything like that. They actually say if a child is well, the child can still go to school.
What?
But what I would say is if the child has any blisters on the skin still, I would keep the child at home because the fluid in the blisters can pass on the disease. Also, if the child is symptomatic with coughing or runny nose or anything like that, I would keep them at home until it's gone.
Because I was going to say, I was going to strongly disagree with you. As a mother, do you see what I mean?
Yeah.
If it is
Yeah.
my child who is affected, I wouldn't want
Contain
to
it.
affect
Yeah.
other children in the classroom because, they touch each other all the time and they're playing with the same toys. I would think that would spread throughout a nursery or a classroom really, really
Yes,
quickly.
it would. Well, it's important, as I said, if you have any of the blisters still fine. You know, you shouldn't go to school, or if you're symptomatic. But otherwise, you know, the stool can maintain some potency and ability to infect for over a month. So it just goes to show how your hygiene, your general hygiene, is going to be important. But you wouldn't want to necessarily keep a child home for a month, you know, because they have
I
hand, foot,
say
and
if
mouth
your
disease.
child has this, keep them home for a month. I'm
Yeah.
sorry.
Yeah.
You know, keep them home for a month. Find other ways of taking
Get
care
the
of your child.
information from the school and make sure they understand what
Yeah.
they're supposed to be doing. If they can still, you know, talk and they can still read and they're not, you know, you can.
Yeah,
then
once
get
your
the
hygiene is
information.
good,
I don't think
that
that's fair
wouldn't
to
be
the
a
teachers and the
that wouldn't be
caregivers
a
either.
possibility.
That was very passionate about this. you
Yes,
understand?
obviously a caring young mother.
Well, what
You know
I
what?
think,
Exactly.
Yeah.
But the thing is, okay, you know what? Call us, 228-5562 or 228-5563. What's your opinion, whether it's your child or someone else's child that's affected by hand, foot, and mouth disease, depending upon the stages? And you heard what he said in terms of that 1 month period. What's your opinion on if the child should be allowed to go to school or be kept at home? Remember, we're talking about children perhaps 5 years or younger.
Well, we have to look at, I mean, in a school environment, kids go to the bathroom all the time. And, you know, once they know how to take care of themselves and they wash their hands carefully, nothing is going to happen.
Have you met a
Right.
5-year-old
They don't
recently?
think about all that stuff all the time.
You know, they go like this. And they run off, you know, they don't wipe the toilet seats off properly.
Oh.
That's the things that you're constantly trying to reinforce for them.
Yeah,
You know?
I know. That's why all the home training and school training come together
Yeah.
to make that child that we really want.
We got you. We hear you loud and clear. Is it more prevalent in our world, or is it?
No,
You
it
mean in the
isn't.
tropics?
But in the colder areas, it's more later in summer that you get it and beyond.
Okay. Wow. So let's recap how it looks. Let's recap how it happens and the treatments.
Yes, it's the usual viral infection and passed on like any virus through droplet infection. It starts as little red marks, which may be just a few millimeters. Marks become, we get a little blister on it, which may
And
be
we've
a few
showed you.
millimeters. Yes, with a red halo. And you can also have little erosions on the skin in the mouth as well. Predominantly the palms and the soles, or it can be the top of the hands or the forearms as we showed before. In 10 days it goes away. Usually the person feels pretty good, except they may have a bit of some viral symptoms, and it resolves very well. If you're very unfortunate, you could get infections of other parts, other organs in the body, but as I said, that's very, very uncommon.
Okay.
All right, we do have one of our viewers on the line. Good morning to you.
A blessed and God-filled New Year to each
Hello,
and every
Gail.
one
How
of
are you?
Good morning.
Good morning. What's your
lovely Devil? Good morning, Dr.
Thank you.
Ford.
Good morning, there.
Good morning. What's your question or comment?
My opinion is that the child should stay home for the month.
Okay.
Okay, well,
I think we agree. The doctor's just trying not to cause any panic.
yeah.
They try to keep things panic free.
Right.
We don't care. We're keeping them home.
Because you know he'll get phone calls from
Yeah.
the fraternity.
I would want, like you said, I would want the other parent to think the same thing and do the same courtesy.
Yeah.
Because it's
Okay.
better that way. If it's just one person.
Better safe than sorry then?
Yeah.
Yes.
It's, yeah, for me, it's all about
Because they're
containment.
touchy-feely
Yeah.
little people. But thank you very much,
Okay,
Dr. Ford.
thanks.
And we appreciate all your contributions during the year. You opted not to cook a dish and bring it last Wednesday, Christmas Eve, but we appreciate your company anyway. We had a
We're
blast.
going to work on it for next year.
Yes, yes, absolutely.
whole
That's
year
the
to be
deal.
on a meal.
Put it in the
Put
fridge.
it in the fridge or under the
Freezer.
tree,
Put it in the freezer.
just in case. But thank you, Dr. Ford, for sharing with us.
Okay. you're
All right,
welcome.
we hope you found it enlightening as well. We'll be back. We're going to talk etiquette with Stephanie Goddard, etiquette expert.